Hi, everyone. This is Team 2, and the theme of Team 2 is Bridging the Meal Gap. Our high impact question was, how can we close the meal gap in Allegheny County by optimizing food networks in the area to enhance the equity of food distribution? We had 4 focus areas, which were to identify vulnerable areas, assess the location of food distribution sites, and then also evaluate poundage distributed by each site to identify the most served regions. And on the right are our outcomes. We conducted a literature review of predictors of food insecurity. And then using this literature review, that informed the creation of our food insecurity index for Allegheny County using significant predictors. We then spatially identified food insecure regions and underserved regions. We found a list of potential food bank partners and also assessed all of these in Tableau. The first part was to identify populations vulnerable to food insecurity in Allegheny County using a unique food insecurity index. This is an overall summary of how we created the index and the data that was used within this variable. It is one composite score, and it includes information on poverty, percent renters, chronic diseases, lack of health insurance, and mental health. But what is most important to know about our index is that it is novel and tailored to Allegheny County by including predictors of food insecurity, specifically for the community in Allegheny County. And the purpose is to identify potentially vulnerable populations.
After developing this index, our first step was to plot the scores by zip code in Allegheny County. In the map on the right, darker red areas indicate those with higher food insecurity scores or higher need, while darker blue regions represent those with lower food insecurity scores. The middle of this color gradient was at 100, which represents an average across all of the factors in the index. Zooming in to look at some areas with the highest scores, we see 2 main points of focus: around the city of Pittsburgh, specifically in the Hill District, and the area around Duquesne.
After we mapped the need in Allegheny County, the next step for our team was to map the activities of the food bank and see how well those activities were matching up with the need in order to gauge equitable distribution. We created a map which shows the distribution of the food bank's resources across zip code areas in Allegheny County. This map takes into account the poundage of food distributed, which is scaled for population, and the number of sites present in each zip code area, scaled for both population and geographic area. So this is an interactive map. So judges, you can hover your cursors over certain zip code areas to see more information about them, and you can zoom in and out if you want to. So when we compare our map estimating need on the right to our map showing the food bank's resources on the left, we see that overall the food bank is very effective in allocating their resources to higher need places. However, we can see that there are certain areas, southeast of the city, for example, that are identified as high need, but not highly served. And these areas present an opportunity for the food bank to evaluate partnership and distribution activities in these areas. We actually did create another interactive map with potential partners listed in zip code areas where we are seeing a discrepancy in need and the portion of food bank resources they're receiving. That map is also interactive, but in the interest of time, here's an image showing the map. And we hope that this tool demonstrates how our idea results in actionable outcomes. Speaking of actionable outcomes, here are some ways that the food bank can use our tool. They can decide where to concentrate food distribution efforts. So one example of this is considering new partnerships in the areas we identified. The food bank can target areas for non-food interventions, such as SNAP enrollment pushes and other programs. And because of our tool's flexibility in dealing with time periods, it can be used to assess resource allocation at any point in time and across any range of time. For example, if the food bank wanted to know how equitably its resources were allocated this month, we could figure that out. And lastly, this tool could be used as an evidence-based support for seeking grants and advocating for policy decisions that impact certain areas. Some ways that we or the food bank could continue our work include sharpening the food insecurity score to include more metrics such as accessibility, accounting for travel between zip code areas, adding more potential partners to the map, and assessing equitable distribution among certain vulnerable groups such as the disabled, children, or racial and ethnic minoritized groups.
So then the question becomes, why choose this approach? Well, for one, it's repeatable, it's simple, and it's feasible within a year. The model itself is very flexible and versatile and would allow the food bank to add a new index or hone in on specific outcomes. And here are some potential questions that could be answered with the data that we have. Are racial and ethnic minoritized groups benefiting from distribution sites? Where are populations with increased chronic diseases or disabilities that can benefit from medically tailored food delivery? Beyond that, it's also expandable beyond Allegheny County and includes unique approaches that aren't used at other food banks. So even though we focus on Allegheny County, this could be expanded to other areas in Pennsylvania. Then why Team 2? Well, Team 2 has produced a number of interactive and sustainable sites with maps on Tableau, which would allow the food bank to interact with our data, use it for a variety of resources and metrics. We also consulted with experts and created an evidence-based score. So our score is based on significant predictors of food insecurity, and we collected data on these specific variables. We conducted a holistic geographical review of barriers to food access. So we not only identified the barriers, but we also made efforts to resolve these barriers using our data. And finally, we also just have a diverse team inclusive of a variety of disciplines. So we bring a lot of unique perspectives on how to solve this issue and work with existing partners in Pittsburgh. And these are the links to our maps, and we look forward to you talking to the judges. Thank you.